when we are going through depression, we see no hope, we see darkness, we have that emotional bluntness, that blandness, that lack of joy, and deep, dark hopelessness that we feel. And one of the reasons of that hopelessness is the nature of the illness, but it's a very serious illness, and very serious when you're hopeless because of the suicide factors in depression. And so if if we can find our faith, that may help. So Bruno, I want to ask you a little bit about your study. Talk a little bit about the study and what you found and how you framed it.
Okay, I'm a psychiatrist in Brazil, South Brazil. In this study, we evaluate depressed patients with severe depression, poor quality of life, many symptoms, a high suicide risk, and we want to know whether spirituality and intrinsic religiosity would impact their symptoms and their quality of life, their resilience, and some biological markers also in depression.
Right. Now you're talking about the religiosity now. So what was the definition of religiosity? Explain the factors or the questions that you had to answer for what determined something to be religiosity.
Okay. The main thing we want to know is to study intrinsic religiosity. That is the subjective domain of religiosity. It talks about faith, the degree of commitment, the level of belief that people have in religious things. And it can be differentiated from organizational religiosity, that is institutional attendance to church, a temple, and from private practice such as pray or reading the Bible and things, meditation, all important domains of religiosity. But here we want to look at intrinsic religiosity, the subjective domain of religiosity.
So then, did you obviously you interviewed patients, correct? You interviewed people in the study, and how many people did how big of a field was your study in? How many people participated?
Okay, in this study we have 143 patients, inpatients in Brazil, and we interviewed them in admission to the unit and before discharge. And we evaluated sort of clinical outcomes from depression, general psychopathology, social demographic factors, quality of life, resilience, and we try to know whether intrinsic religiosity can influence this kind of things.
Okay. So was there a questionnaire that the patients or the people dealing with depression filled out?
Yes.
A questionnaire? And how long was that question? How many questions was there?
We have a very comprehensive questionnaire, including validated instruments to depression, to quality of life. We use the Duke University Religion Index to evaluate religiosity, to have a very, very specific findings and to correlate scientifically.
Great. And what was the length of the study? From what period of time? How long did it take you to gather all the information and the results and that? How long was the study?
Generally, we work in this 2 to 3 years to
2 to
collect
3 years.
all this information.
Wow, that's quite a lengthy study,
Yes.
isn't it? Wow. Okay, so now let's talk about conclusions. What were the conclusions? What did you find out?
We were very surprised in our results. We know from literature that religiosity is a very protective, has a very...
Very private. People are very private about the religiosity. Did you find that?
Yes. People usually, it's interesting, they want to talk about these patients, especially. But we know that religiosity in many studies has a protective effect affecting depression. And we find this in our study. Patients who report high intrinsic religiosity have a higher remission of depression, report higher quality of life, higher resilience scores, and fewer suicide attempts, a very important thing to mental health.
Right.
And the original finding of our study is that these patients with higher intrinsic religiosity present a higher BDNF, that is a biological marker that may explain why religiosity is so important to mental health and depression especially.